that? By the way, I do. Did it again. I'm glad we have hair. I've been trying to get this woman's ear out of this ad I'm doing all day. Because it's, where is it? Tish, you described it.
It's like on her collarbone.
It really is.
Her ear is on her collarbone?
And I love the image. She's dripping in gold. And it's all over her face. But her ear is literally on her collarbone.
It's past
I'm going
her
to show it to you.
jawbone.
And I've been trying to Photoshop it. And sometimes I just... But I don't know why these people won't just put their hair in front of their ears. It looks so much better there. But he set up for me.
Oh, me?
Yeah.
Okay. I thought Tish set up.
You don't want to do anything I did.
Oh, you're drawing on me?
Yeah.
I watch you when you draw in the other videos.
Hmm?
She thinks she's going to do that wide spot, girls.
I am. So Kybella is deoxycholic acid, which is it's like a bile salt. And you can use it all kinds of places. FDA approved, it's right under the chin, and that's where we're going to do it. She's had cool sculpting, and she had a very dramatic result. Although, let's go ahead.
Who said it wouldn't work?
I did.
And tell them what you came. She told her it wasn't going to work too, so I told you the truth. I think.
Mm-hmm.
I mean, because I knew I wanted to do it, but I think I told you she didn't think it would work.
Yeah.
Mm-hmm.
But
I even put in the note. It's not. She knows it's not going to be a home run. I put it in quotations.
She didn't want to do it. You didn't want to do it.
No, because I was like, I don't know if it's going to work, but it
so
did.
we just did one because the truth is, if it doesn't work, what else can she do? And that's what it comes down to, because there's not any other option for reducing that other than having a facelift, and you're losing weight. You've got other things, and so this is how you non-surgically reduce it. And if you were to have liposuction, we saw somebody today with a defect. I mean, you don't want to loosen the skin. Liposuction is not a good idea here as you age and you have looser skin. It just doesn't work. So
yeah.
It worked great though, and now we're using the Kybella, and I use them together a lot. It does. Does it hurt? We're ready though.
I've already told you all the bad things that can happen.
I am not going to be a Tish.
That's right.
Oh, good. My God.
She'll like you better now.
No, I love Tish.
Hang on, I'm coming over on this side, girls.
Little sticks. You okay?
Mm-hmm. Is it bleeding any?
Not yet.
Some of yours bleed. I noticed.
Well, I mean, I can't help that,
Yeah, I know.
Like, I can't predict it unless I can, But if you take aspirin, ibuprofen, even green tea, if you have red hair, if you're Tish, Tish takes a lot of ibuprofen.
I do. I had red hair when I was little too.
I used to put it on with this grid. Now I just decide. I know where I want it. The density of your fat is kind of how I decide.
Wasn't that sweet? The density of my fat.
It's dense, and when fat is dense and you've done a whole lot of it, you can tell that it's going to take more than one thing. Like more than one modality, like either cool sculpting twice or Kybella. Now, the reason I like to do cool sculpting first is because Kybella can always it swells. So the less volume of fat you have there, the less you're gonna swell.
I got you.
So we basically bulk reduce with the cool sculpting, and now we're doing the Kybella.
Gotcha.
So you're gonna have about a week to 2 weeks where it's puffier than normal. Now Tish said,
I was not gonna say
for Tish, but mine was already puffy 3 months ago.
Tish, how many people noticed it? Would you grab my laptop, get VZ to bring it so I can show them the picture of that woman now that I'm talking about her? And Alicia, would you ask someone to pull up her cool sculpting picture so we can show them?
Absolutely.
Her before and after. Anyway, 1 to 2 weeks of that. But even Tisha, how many people said to you, your neck looks swollen, other than us?
No one.
Okay.
Not
That's
even
what's
my
amazing.
family.
Yeah.
Like, she didn't know if they were scared, or I think they would have said something. Your family.
Yeah, they would have said something. They'd have called me out on it. They'd have been on Snapchat and the billboard probably. So I just think they didn't notice.
Yeah.
it would have definitely been on Snapchat, but we're glad that
Well, we're our own worst critic anyway. So.
we are. But I mean, it was interesting to. I mean, it's true though. Even when people go have a facelift, they're shocked by how few people say, you know, I'd love to say it's because it looks natural, and it should, and they do. But at the same time, people don't study us the way we, study ourselves.
Yeah.
But within 2 weeks, most of that will be gone. About 80, most of your swelling will be gone. And then you can have some numbness or tingling, or it just feels a little different. And then over the course of the next few months, at 3 months, you'll be kind of with where you're going to be with it.
Okay.
It'll be interesting for you to tell us the cool sculpting versus that. But for the most part.
Versus Tish's.
No, yeah.
Her version.
Yeah. She's going to have a good result, though. She just didn't realize it. If she doesn't, she wants a live mini lip.
Yeah, she wants a jaw. She wants to live her jaws.
I know. I want to
do her jaws.
Mm-hmm.
That's what she wants.
Yeah.
But I don't see any jaws on you.
I know, I really don't either. I'm hoping this is going to work. We won't have to do it. It's a lot better than it was.
Mm-hmm. It is better, but I just don't look at it now.
Yeah.
You'll get there, believe me. Tomorrow you'll be like, oh, I see what you're talking about.
But as long as you know that, you don't get in that position. Will you show them her before and after?
Okay. Okay. This one on the left is the before, and this one on the right is the after. That was after 1 cycle of cool sculpting. And it's 3 months later.
So this is what I'm working on.
This is the after.
Y'all see this woman?
Oh.
Wait, I've turned her every which way for this. Look
Oh
at her
my
ear.
gosh.
And I've turned her this way. I've moved her. I've flipped her. But I really like her. I just don't like her ear. I mean, and Tish walks up and I said, I'm trying to move her ear. I bet that some of that's, I mean, I don't think her ear's that low. And Tish said it's on her collar, but I think it's the way her neck is hyperextended, but either way.
So is that all of it?
Can I show them that? Have we showed them?
Mm-hmm.
That's so good. Now, what's the biggest difference you see?
When I look at it, I don't see just it hanging down. I can see. I can see this.
Mm-hmm. You sure can. It looks really good. I mean, really good. Okay.
Tish and I were just wondering if you just cut that off. That would just.
Everywhere you cut, you have to have a scar.
I know. I was teasing. I wouldn't let you cut it anyway.
I wouldn't cut it.
I'd
Because I'd have to
probably bleed to
Photoshop your
death.
pictures. Like, you don't want to be worse than the ear I've been playing with. I like all the gold.
Yeah.
We were really excited about Bruno Mars. I was trying to come up with gold something. You know. Did you watch the Grammys last night?
No.
I didn't either. I didn't either. Is it burning? Are you okay?
Mm-hmm. And no, it's fine.
You want to keep the ice on a little?
No. That.
No.
It's too cold.